Care should be taken handling all sharps, using instruments and never the hand. The scalpel blade is carefully removed from its packet using needle-holding forceps. It is held at its tip, allowing it to be attached to the handle. It is also removed with forceps and carefully disposed of into a special sharps bin. The scalpel is held between the middle finger and thumb, placing the index finger close to the blade, applying downwards pressure, and the other fingers steady the handle. When cutting the skin, a single positive stroke should be performed.
Here we have two types of needle holders. One is a smaller, gold-tipped needle holder for finer work. The larger needle holder is for use with larger needles, such as those used in closure of the abdomen. Here we see the jaws of the needle holders, showing the serrations which are cross-hatched for maximum grip on the needle. Again, the needle holder is held in a similar tripod fashion, using the thumb, index and ring finger. The ratchet mechanism generally requires just one click to securely hold the needle, without causing damage or bending to the needle with too much force. Here we show an alternative technique used to grip the needle holder. This is the palm technique, where the thenar eminence is used to open the ratchet mechanism. Again, it is important to try to keep the index finger down the shaft of the needle holder to maintain stability. After opening the suture pack, the needle is presented ready for mounting in the needle holder. Grasp the needle with the tip of the needle holder, 2/3 along the shaft from the needle tip. When removing the suture from the pack, it is often useful to use your little finger to take up the slack in the suture. The needle can either be held 2/3 away from the tip and perpendicular to the needle holder, or when using a half-curved needle, it can be held halfway along the shaft at a slight angle as demonstrated. It is important that the needle is grasped at the tip of the jaws of the needle holder.
Let's start by examining the needle holder. This is a ringed instrument. You'll notice that there are two rings in back, a ratchet, the shaft or body of the needle holder, the hinge, and then the jaws of the needle holder. If you look inside the jaws, you'll notice that there are serrations. This gives us better control over suture material and also various types of needles. Now let's look at the control methods for the needle holder. First, we'll start with the finger control. The thumb goes in the upper ring, the ring finger goes in the lower ring. The index finger goes on the body or shaft of the needle holder. The middle finger and the pinky can add stability to the lower ring. To open the needle holder in this manner, you will push forward with the thumb and push towards the palm with the ring finger, the middle finger, and the pinky. Notice that we have multiple points of contact on this needle holder. Now let's look at the palming method to control the needle holder. The upper ring goes on the pad of the thumb. The index finger will again be applied to the shaft or body of the needle holder. The pinky, ring finger, and middle finger will be applied to the lower ring. To open and close the needle driver using this method, push towards the palm with the pinky, ring finger, and middle finger, and oppose that pressure with the pad of the thumb.
For routine use, a curved needle is gripped approximately 1/5 in from the suture attachment end at right angles to the forceps, and also held well within the jaws for maximum security. For penetration of tough tissue, the needle may be held at its center, and for deep sutures, it may be necessary to hold it very close to the suture attachment. Never grip the sharp end, which is easily damaged. Needle holders, artery forceps and scissors are all held in the same way. The ring finger and thumb are placed through the rings of the instrument. The index finger is placed along the shaft and, together with the middle finger, steadies the instrument. During small bowel resection, the vascular arcade is identified, sometimes aided by translumination, and suitable sites for ligation are chosen to devascularize the bowel but maximally preserve circulation. Windows between the vessels are opened, forceps applied, the vessel divided and ligated with absorbable sutures.
Hello, I'm Dr. Candice Castro, a general surgeon at the Academy of Health Sciences, Physician Assistant Branch. I'm going to show you how to suture an uncomplicated laceration using a model of the forearm. Assisting is Chief Warrant Officer Tom Milliken, an orthopedic physician assistant.
Let us assume that it is appropriate to close the wound with suture. That is, the wound is fresh and clean rather than several hours old or heavily contaminated. Remember, animal scratches and bites, or wounds that are sustained in the field around machinery or tools, and all combat wounds are generally considered to be too contaminated for primary closure. Wounds that have been closed are more likely to become infected than wounds that have been cleaned and dressed open. If you are instructed by a surgeon not to close a wound, it is not because of your technical skills, but because he considers the wound to be too contaminated and therefore more likely to become infected. Let us also assume that you have already cleansed the wound and its surrounding area. If the wound involves the forearm, for example, first the entire forearm, including the hand, is cleansed, and a local anesthetic is injected around the wound. Then the wound itself is inspected in order to remove all foreign bodies, that is, all the glass, grass, gravel, grease, dirt, paint, or whatever else is present. Loose skin and fat are also debrided. Then the wound is irrigated, preferably with sterile saline, but clean drinking water will also do. The area immediately surrounding the wound may be painted with an antiseptic, but there is no need to put antiseptic, peroxide, alcohol, or any other agent directly into the wound. Don't try to substitute these agents for proper debridement and cleansing. After sterile draping, you are ready to suture the wound. It is helpful if you have pickups, needle holder, and scissors, as well as appropriate suture. For a simple skin laceration, generally, monofilament, non-absorbable suture is appropriate. If you do use subcutaneous suture, an absorbable suture is best. We'll use 4-0 nylon on a cutting needle for this wound. It is important to look at the package to see the size and the type of suture, as well as the size and the type of needle. A cutting needle is preferable for use on skin. A taper needle does not easily penetrate skin and should be avoided. Load the needle on the needle holder about halfway along the needle. Some will tell you to load the needle closer to the tip. Others will tell you closer to the back. If you load it in the center, you will probably please everyone. Load the needle with the sharp end pointing up. Pay attention to how you hold the needle holder and other instruments. The ring finger goes in one side of the instrument and the thumb in the other. The index finger remains free to steady it. Holding the instrument between thumb and index finger is not correct. Don't do it. This is the correct way to hold the instrument, with the ring finger and thumb in the handle and the index finger free to steady the instrument. Insert the fingertips only up to the first joint. Now for the pickups or thumb forceps. Hold them like you would a pencil, with the hand below the instrument like this. Don't hold them with the hand above the instrument. Now you are probably thinking, I have always held the instruments my way and no one has ever corrected me before. Also, I'm used to my way and would be uncomfortable doing it any other way. Anyway, who cares how I hold the instruments as long as I get the job done? What if I were a novice carpenter and were going to demonstrate how I hammer in a nail?
I've always held the tools this way and nobody's ever corrected me before. It would be uncomfortable for me to hold the tools any other way. Anyway, who cares how I hold the tools, as long as I get the job done?
Surgeons hold instruments this way, and they do this for a living. There must be a reason why they do it this way. It is more comfortable to sew toward yourself. That is, start at the far end of the incision and work back towards yourself. Now hold the needle holder with the tip of the needle and the palm facing down. Pretend that the needle is straight rather than curved and push straight down into the tissue to the desired depth. Then slightly turn the wrist as though you were turning a doorknob. If you are taking 2 bites, let go of the needle and re-grasp, keeping the palm facing down. Avoid grasping the needle with your palm facing up, as this will make it hard to turn the wrist in a smooth and natural manner. Insert the needle into the opposite side of the wound at the same depth as the first side. Note that it's not always necessary to hold the skin edges with the pickups. If you do use the pickups to hold the skin, use them gently rather than leaving rat tooth marks in the skin. Also, it's not usually necessary to steady the needle with the pickups. After completing the stitch, it's time to do the instrument tie. The suture forms a V shape, with a long end having the needle and a short end. Hold the long end in one hand and the needle holder in the other. Insert the needle holder into the V. On the first throw, wrap the long end of the suture twice around the instrument toward the short end. Take the short end of the suture with the needle holder and pull it to the other side, watching the throw go down flat. Once again, you have a V with a long end and a short end. Again, insert the instrument in the V. For the remaining throws, wrap the long end once toward the short end, take the short end and pull it to the other side, watching the knot go down square. Here's the V, instrument in the V, wrap the long end toward the short end, grab the short end, pull it to the other side. Instrument in the V, wrap the long end toward the short end, grab the short end, and pull it to the other side. Notice that your hands will cross and uncross as you perform these square knots. For nylon or other monofilament suture, perform 4 or more square knots, leaving no daylight between the knots. You want the knots to be tight and square, but you don't want to crush the tissue with the suture. Imagine that you have a dog to walk, but no leash, so you're going to use a rope as a leash. When you tie the rope around the dog's neck, you want the knot to be tight and square so that it won't slip, but you don't want to choke the dog. When you're suturing and your instructor says, "Don't choke the dog," it means that you are crushing the tissue with the suture. Here is a wound that has been closed with the correct tension. Here is a wound that has been closed too tightly. This is a series of simple interrupted stitches. The simple interrupted technique is suitable for almost any wound. Here is a wound closed by a simple running or continuous technique. Now I will show you the vertical mattress technique, which is used to ensure that the edges of the wound will evert or turn outward instead of turning inward. Start the stitch the same way as for a simple interrupted. Before tying the knot, turn the needle around and go straight back to the other side of the wound, catching just the very thin edge of the wound on each side. Then tie on the side of the wound that you started on. Notice how this everts the skin edges so that they don't cave in. This technique is especially useful for deeper wounds in which you fear there will be dead space. Another technique is the running subcuticular, used for very clean wounds in areas of cosmetic importance such as the face. Be sure to use a cutting needle rather than a tapered. For purposes of this demonstration, black silk will be used for better visualization. When using absorbable suture, one end is anchored near one end of the wound and brought out at the very tip of the wound, but not through the outer skin. If necessary, use the pickups for better traction on the skin. Guide the needle parallel to the skin, just under the surface, that is, in the subcuticular area. Notice this is not as deep as the subcutaneous layer where there is fat. After the first stitch, start the next one directly across on the other side of the wound. Continue in this manner to the end of the wound. There are a number of ways to secure the end of the suture. Remove the needle holder, leave a loop at the end of the suture, then insert the adjacent suture partway through, creating a second loop. Tighten down the first loop. Then insert the needle in through this new loop and tighten it down. Replace the needle on the needle holder and carry the stitch through the very tip of the wound, from inside the wound to some nearby site outside the wound. Cut the suture so that there is none protruding from the wound. This procedure can also be performed using monofilament, non-absorbable suture, but it must be anchored outside the wound and later removed by cutting the anchoring stitch and pulling on the opposite end. Shallow wounds can also be closed using special tapes. Preparation and cleansing of the wound is the same as for suturing the wound. First, dry the skin edges and possibly degrease with alcohol. Remember, alcohol does not go into the wound itself. Keep a sponge handy so that any blood or serum from the wound will not wet the area. Use a pickup to handle the tape to avoid getting blood and powder from your gloves on the tape. Pull the skin edges together as you secure the tape. Dress the wound with a small dressing and tape. Wound cleansing is more important than suturing. Wounds that are closed are more likely to become infected than those that are cleansed and dressed open. If you are unsure as to whether or not sutures are indicated for a certain wound, remember, when in doubt, leave them out.
Okay, welcome to the second video. In this one we'll be learning about the one-handed surgical knot, which is what you're going to primarily use in the OR and wherever else you might be tying these knots. So the first thing you want to do, this is the exact same knot as we just did with the two-handed knot, but instead of switching hands with each of the pieces of string, we're actually just going to be doing all the work with the left hand, and the right hand will pretty much just be standing still. So what you're going to do to set up for this one is you're going to have the left string, which is the purple string in this case, again going away from you, kind of over your index finger and the free end, kind of that direction. The other hand you're actually going to reverse. Just kind of for comfort's sake, I like to hold it like this so that the free end is going past my pinky. Down there you'll see. And yeah, it's kind of a matter of preference, but it kind of works very well for the setup we're going to be doing. So the first thing you're going to do is you're going to pinch the purple strand in your left hand, and you're just going to pinch it with the first two fingers, and you're just going to let it kind of lay just nice and easy across the other fingers. And so what you're going to do is you're going to wrap the white strand around your left three fingers so that it's going the opposite direction of the purple strand, and this is always going to be the case in both moves. So purple strand is going away from you, so the white strand needs to come towards you so that the free end is down here coming towards the pinky. Alright? So then what you're going to do, this is kind of the tricky part, you're going to curl your middle finger so that it goes over the white and under the purple, right? And then what you're going to do is you're going to straighten out your finger and kind of pinch the purple with these two fingers, with your middle finger and your third finger, or fourth finger rather, and you're just going to use that to pull it through that little white loop that we've got going there. So I'll do that one more time before moving on. So you got the purple strand going away from you, you got the white strand coming towards you, and you're pinching the purple strand with your first two fingers, and you're laying the white strand coming towards you in the opposite direction of the purple strand. You're curling your finger so that the white is under the tip of your finger and the purple is over the tip of your finger. Straighten out your finger, pinch with these two fingers, and pull it through. Okay? Now what you'll notice is once you pull that through, that if you pull it tight, it's going to look all messed up, just like we showed you in the last video. So what you want to do is you want to actually switch your hands and pull it tight, and you'll notice that it lays nice and flat and it looks exactly like it did after the first move of the two-handed knot. So what you're going to do at this point is you're going to lightly uncross them without kind of yanking on it to undo what you just did. And now both strands should be coming towards you. So the free ends should be closest to your pinkies, not your forefingers. Your forefingers should be closest to the knot. Okay? And so now what you're going to do is you're actually going to use your first finger, and again you're going to put the white strand over the left finger in the opposite direction of the purple strand. So the purple strand is coming towards you now, so now the white has to go away from you instead of towards you like the last one. So what I want to do is I want to curl my finger again, and I'm going to use my thumb to actually lift the purple strand over the back of my first finger. Alright, so I'm doing the exact same thing I did with my middle finger, I'm doing it with my first finger. I'm pulling it over the white, under the purple, and then I'm straightening out my finger and using it to pull it through that white loop again. Okay, and now I'm going to grab it, and this time I don't need to cross my hands because it's nice and flat, and you'll notice that's the exact same knot that we tied last time with two hands. So I'll do that again, starting with purple away from you, white coming towards you, pinch, three fingers coming towards you, opposite direction of the purple, curl your middle finger and grab the purple strand, pinch, and pull through, switch my hands and pull it nice and tight and get it nice and flat, lightly uncross my hands. Now purple is coming towards me, so white goes away, use my thumb to lift the purple over the top, and then just pull it right through that white loop and pull it nice and flat, and you can straighten that out so that you get that nice little ladder pattern again. And that's essentially it. You can do this with the opposite hand. There's a couple of different ways to actually pull this off, so don't worry if someone teaches you another way. It's all the same knot. So there you go. That's the one-handed surgical knot. And in the next video, I'll be showing you how to do an instrument tie. Alright, this is video number 1 of 3. This is showing you how to do a two-handed surgical knot. So the way you're going to start this is setting up with your Ethicon knot tying board with the purple strand on the left in this case and the white strand on the right. And the way you're going to set this up is actually right before you do anything else, you're going to cross these over the top so that the white is now going to the left and the purple is going to your right. And you'll notice that the white is actually coming closer to you in front of the purple strand. So this is how you're going to be set up. You're going to grab these two just like motorcycle handles, right, so that the free ends are going towards your pinkies, like right there. That would be the free end there. And so the first thing you're going to do here for the first move is you're going to make a nice little loop of the white strand over your thumb. And you always want the purple and white strands to be going opposite directions, and so in this case the purple strand is going to go over to the right. And then what you're going to do is you're going to make a little bird beak. Okay, so the bird beak on the other side, bird's going to come through the hole, right? So you're just rotating your hand, you're not letting go of these two fingers, they're always attached here. So you see how I just rotate that through. Bird grabs the worm on the other side, so I'm going to, okay, so I've made my loops, I made my bird beak, comes out through the hole, grabs a little worm on the outside, and pulls him right back through where he came from. Okay? And then on the other side, you're just going to grab the purple strand and pull it nice and tight. Don't worry, we'll go over that again. But that's the first move. And notice how it lies nice and flat, as any square knot should start out. The second part of this move is the first part in reverse. And so instead of making a loop over the thumb, we're actually going to make a loop over the first finger. And again, we want the purple and white strands to be going in opposite directions, so I'm going to lay my purple strand over going away rather than coming towards like the white strand here. And again, we're just going to do the exact same thing. We're going to make our bird beak. Bird goes out through the hole. Again, not letting go of these two fingers, just rolling it right out. Grabs the worm on the other side, pulls him through, and grab on the other side. Now you'll notice that if we pulled this down, it would be all twisted, so what we actually have to do is cross our hands and lay that down so that it lays nice and flat, and you'll notice that this looks like a nice little square knot. So to make sure you're doing this right, you should have a white loop here with two purple strands coming out, and you should have a purple loop right here with two white strands coming out. Okay? And notice that now that we've uncrossed our hands and tied that knot nice and tight, that we have the same setup. We have white going left, purple going right, and the white strand is coming closer to us across the purple strand, which is farther away. So now we can do that again. So going through it nice and slow, you've got your white strand going to the left over the top of your thumb. You're going to wrap the purple in the opposite direction towards your right. You're going to make your little bird beak here. You're going to rotate him out through the hole. And you're going to grab the little purple worm outside. And then you're going to drag that worm back into your little nest. Okay, on the other side, you're going to grab him. And you'll tie it down nice and tight. You can make that nice and straight. And again, now that you've done that, you're going to use your forefinger for the opposite move. Again, you're going to want your purple going to the other direction. You're going to make your bird beak, rotate him out. Grab the purple worm, pull him through the hole, and yank out. And again, to lay it nice and flat, we're going to cross our hands and do that. And you'll notice after a couple of repetitions that you should get this nice little ladder pattern going on here. And that should tell you you're doing it correctly. And if it doesn't look like this, be sure to just kind of like straighten out your knots every time and make sure it looks pretty. So that's basically it. Check the description box below for links to the other two videos in this series, tying one-handed knots and tying instrument ties.
An instrument tie is often used on the skin and for delicate, accurate suturing, such as intestinal or vascular anastomosis. Surgeons often put a double throw on the first tie to prevent the knot slipping. When tying a deeply placed vessel, it is important that the surgeon takes the knot down to the vessel, rather than pull the vessel upwards, which would risk avulsion.
So this is a simplified square knot, two-hand tie. So we're going to start by crossing our strings here. I'm right-handed, so I'm going to make an X up here, you can see. I usually pinch right here and push one side through. And we've already created the first portion. The second step, we're going to place our hands like this, take our left thumb, pull over, and kind of loop our thumb in between the strings, pinch, and push the top towards you. And you should get a nice square knot.
This is the one-handed surgical knot that I showed before, this time with an explanation. First, when I get the suture in my left hand, I make like a chopping motion, which you'll hear a lot of times, or you'll see a lot of times done with the third and fourth finger. I just chop with all my hand as I'm pinching, I guess, the proximal end of the suture. Once I make that chopping motion, you'll notice that I have the top side of the suture in my right hand. I grab it in my hand, make like a little pistol, which you'll hear people say as well. And as I pull it over my middle finger, I can then slowly pass it underneath. Show again. So I chop, pull this over just the tip, just the distal portion of my middle finger. That allows me to bring it underneath just by flexing my middle finger. As I flex it, I'm catching the string on top, which is my left hand, and I squeeze my two fingers together, my third and fourth digits, and I bring them down and under. And that's my first. And of course, push the knot down. That's my first throw. Now, I'm going to do that one more time. You'll see a lot of surgeons do this. I chop again. My little pistol grip here again. Over the distal part. My third finger. Run it underneath. Pinch these two together. So it's my third and fourth finger right here. Pinch those. Pull it under. Now you can see the string back here. You push it down. Every time push it down. So it's fairly snug. And you can see how snug it should be. You know, you shouldn't be cutting these or ligating these two rubber pieces, but now comes the other throw, which will lock it. You make a kind of pistol grip with this side. The key to this side is my lateral portion of my left thumb here. I want to push the suture out just a little bit so it's under tension. Bring the string or the suture that's closest to me up over just the middle, most distal part of my finger, and I move my thumb until I loop that around, and I grab these two fingers again, my second and third digits. And this time I'll push down. And I'll show that again after I make my other throw. Chop over the top. Third and fourth digits together. Push it down. Pistol grip. Make sure you have this string right here, the suture. In this case I'm using 1/0 polysorb, which handles a lot differently. Sometimes it kinks up on you a little bit. So the bottom string comes up. Run my fingers underneath. Right here is a little bit different technique. I'm going to grab the suture between my thumb and first finger, second finger, and push down with my middle. One more time. Chop. Chop. Push down. Now, I'm scooping underneath, and it's at my distal part of my finger at the joint. This is going to come halfway. Kind of bisect that right there. Now again, the thumb, super important. As soon as I bisect that, I'm going to push my thumb a little bit. Pushing, pushing, catching it with the tip of my finger, and grabbing this little piece right here. Now take your time with this. You can do this. And slide the knot down. Very nice. I hope you enjoy this, and I hope you practice a lot. I know it's not easy, especially if you're a student. 3 hours into the surgery, they ask you to close, and you're freezing, and your hands are cold and dry. You can definitely do this. Try it nice and slowly at first. Thank you.
A right-handed surgeon uses his left hand for basic knot tying. The result should be a square reef knot. In practice, 3 or more throws are often used.
One-handed knot tying. Okay, here's the first throw where the tail gets brought in one direction, and this is the opposite throw where the tail gets brought in the other direction. And so on this first throw, the loop gets made over the index finger, and then on the opposite throw, the loop gets made over the pinky finger. And so here the tail gets brought in front and then out the back. And then in this one, the tail gets pushed to the back and then brought out towards the front. And so the keys are that the alternate throws are symmetric and opposite, and then on alternate throws, the tail goes to the opposite side. And so on the first throw, the loop gets made around the index finger, and then the tail gets flipped in and pulled down. And then the next throw gets made around the fifth finger, and the tail gets flipped again and pulled in the opposite direction. And so here around the index finger, the tail gets flipped forward and then pulled back out. Now around the edge of the hand, the tail gets flipped backwards and pulled back down. And so in slow motion, you can see on the first throw, the tail gets flipped forward and then pulled back out, and pulled down. And then on the opposite throw, the loop gets made around the edge of the hand, and the tail gets pushed backwards and then brought down in the opposite direction. And so here we have the same one-handed tie where you have the suture still attached to the instrument. Okay, the instrument stays in the right hand, and the tying gets done by the left or non-dominant hand. Same alternating throws, and you end up with the same nice square knot. So here are some of the problems that can happen. Here's where you throw the stitch in your right hand, you put the instrument down, you pick up the suture, and you try to throw the one-handed tie with the right hand. You can see that it doesn't come down square. Here you have the one-handed throw, but you've started not cross, so you try to cross it, and you take your left hand and you keep the tail on the same side. It doesn't come down square. Here you have the first throw is good, but then instead of bringing the purple strand to the opposite side, you keep it on the same side, and so it doesn't come down square. You can see it almost looks like a straight line. Okay, so here this throw is okay. It's a little twisted, but now instead of bringing the purple across, you keep it the same way, and you can see it's like a straight line. Now if you have good alternating throws, even if it doesn't look like it, here you see that these throws are put in quickly. The right and left hands stay on the same side, but they're going slightly up, and now slightly down, and then back up, and then back down, so the throws are alternating in each direction. So the same thing here, where you have the instrument still attached, the throw goes down, and then up, down, and then up, and so even though your right hand stays on the right, the left on the left, it's still alternating.
And the right hand brings the yellow string closer to the thumb of the left hand. The yellow string is then brought down over the green string on the thumb of the left hand, and an X is made. The right hand then puts tension on the yellow string, and the index finger of the left hand goes through the loop, and the right hand then rotates the yellow string to the thumb and index finger of the left hand, capturing the string. The right hand is released, and the left hand pushes the yellow string through the loop. The thumb goes through the loop, and the index finger is released.
Or not, using the one-hand technique. So we're going to begin with our strings crossed. I'm right-handed, so I'm going to be demonstrating this with my right hand. I generally start with my right hand just like this. I will take the string in my left hand and kind of loop my fingers underneath it while holding the other string in my right hand. Bend my middle finger and try to kind of create a little cat's cradle here. Pull the white string with my middle finger through. Now you've created your first throw. Now what you're going to do is loop the string around your finger and your thumb. Make an X along the other one. And you're going to use your index finger to pull that string through. Kind of becomes a sneaky finger. Let's do one more on top of that. So again, I'm going to take the string here in my right hand, a loop, use my middle finger to kind of pinch it in there. Then I'm going to take the string around my index finger and my thumb, create an X here, and use my index finger to sneak that string through. And that will be a square knot using the one-hand technique.
Mattress sutures are used to prevent inversion of the skin edges, particularly where skin is thin, such as on the back of the hand. A simple suture is inserted first, and then the needle is reversed. The needle is passed back through the two skin edges, placing these sutures very superficially. Monofilament nylon is being used with an instrument tie. In simple skin suturing, the needle is inserted vertically, emerging at the deepest point of the wound. It is then placed deeply to emerge through the skin symmetrically with the first side. Monofilament nylon is often used. Training surgeons initially tend to place their sutures too close to the skin edge and too superficially.
And the right hand brings the yellow string closer to the thumb of the left hand. The yellow string is then brought down over the green string on the thumb of the left hand, and an X is made. The right hand then puts tension on the yellow string, and the index finger of the left hand goes through the loop, and the right hand then rotates the yellow string to the thumb and index finger of the left hand, capturing the string. The right hand is released, and the left hand pushes the yellow string through the loop. The thumb goes through the loop, and the index finger is released.
Or not, using the one-hand technique. So we're going to begin with our strings crossed. I'm right-handed, so I'm going to be demonstrating this with my right hand. I generally start with my right hand just like this. I will take the string in my left hand and kind of loop my fingers underneath it while holding the other string in my right hand. Bend my middle finger and try to kind of create a little cat's cradle here. Pull the white string with my middle finger through. Now you've created your first throw. Now what you're going to do is loop the string around your finger and your thumb. Make an X along the other one. And you're going to use your index finger to pull that string through. Kind of becomes a sneaky finger. Let's do one more on top of that. So again, I'm going to take the string here in my right hand, a loop, use my middle finger to kind of pinch it in there. Then I'm going to take the string around my index finger and my thumb, create an X here, and use my index finger to sneak that string through. And that will be a square knot using the one-hand technique.
nombre es Ada Maribel Ríos Bogado, tengo 13 años y toco el violín.
Me llamo Juan Manuel Chávez, más conocido como Baby, tengo 19 años y toco el cello. Este cello está hecho de una lata de aceite, la madera tirada en la basura y las clavijas son de una vieja cuchara para golpear la carne y para hacer el ñoquis. Y suena así.
Una comunidad como Cateura no es un lugar para tener un violín. De hecho, un violín cuesta más que su casa.
En ese grupo acá mismo encontramos el colador de violín. Y de ese empezamos los instrumentos reciclados. La familia que acá vive recicla todo lo que hay en la basura y se vende. No pensaba antes que yo voy a hacer ese instrumento. Y me siento demasiado feliz cuando estoy viendo a un niño que está tocando un violín reciclado.
Cuando ya escucho el sonido del violín siento como mariposas en el estómago, así una sensación que no sé cómo voy a explicar.
La orquesta de instrumentos reciclados es una orquesta que toca instrumentos hechos con la basura.
1, 2, 3.
Y mi vida sería... Sin la música estaría decoreíble.
La gente se da cuenta que no tenemos que tirar la basura muy fácilmente. No tenemos que desechar a las personas muy fácilmente.